So, Dr. Wilkins, I understand that there was a journal report in JAMA, the American Medical Association, Journal of American Medical Association, in January of 2006, January 4th to be exact, that suggested that the amino acid arginine might be dangerous. Can you speak to that a bit?
Sure can. The naysayers of arginine will use this study a lot to say, oh, arginine is not the right way to boost nitric oxide. And usually they have a nitrate-based product that they're selling that, it goes back to. But yeah, there is this study, and I would certainly like to address that. And I appreciate the question. First of all, if arginine is dangerous, you right now need to go into your refrigerator and get all the eggs out, throw them away, get rid of the meat that might be in there, go into your freezer, get those steaks, throw them away, go into your cupboard, get the nuts out, throw away the beans, right? Because arginine is dangerous and all those things have arginine. So right away, arginine is a naturally occurring thing, amino acid in a protein. So where this idea came from, as you mentioned in this JAMA study or report that was brought out in January 4th, 2006. And basically the individuals in there, they cut the study short because of, this is the conclusion that the study made. It says, the conclusion, L-Arginine, when added to standard post-infarction therapies, does not improve vascular stiffness measurements or ejection fraction and may be associated with higher post-infarction mortality. L-Arginine should not be recommended following myocardial infarction. So 6 people did die in this study. They in the arginine group, none in the placebo group, and so right away people say, oh, well, it has to be dangerous. But interestingly enough, how the individuals even died, 5 of them died within the study. One, it's known, had a myocardial rupture. So we can say that one was related to a heart attack. But 2 of the ones were found dead at home without any prior symptoms, and 2 were presumed to have sepsis. So it's like, how sick were these individuals? It's not clear that these 4 even died of anything related to a heart attack. And then one of them died actually 3 weeks after they stopped the study. So they weren't even taking arginine when they died. So it's real sketchy as far as the deaths were concerned and what really happened. These had to be very, very sick individuals. But what I'd like to call your attention to is Dr. Joe's Prendergast, his rebuttal. I actually have a copy of it right here. And he got right on this. He was pretty incensed because just a few days later, on January 13th, he wrote this rebuttal. And I'll just read it.
Can I interrupt you for 1 second?
Please.
Can you remind us of who Dr. Joe Prendergast is?
Yes, thank you. We have a whole interview that we did on that, a video on him and what he did in his practice, and it actually mentions it here. But he's a diabetic specialist. So this actually comes from the Endocrine Metabolic Medical Center, which Dr. Joe is the chief medical advisor for that medical center. But he had years and years of experience, 25 plus years of using arginine with great success in his practice. So it starts out with just a little paragraph, L-Arginine therapy in acute myocardial infarction. And he says there are over 50,000 studies which are generally positive on the use of L-Arginine to improve arterial lining, the endothelium elasticity, atherosclerosis, homocysteine, and viral damage. I have had 2,600 patients over the last 10 years with less than 0.5% having any heart disease, which is remarkable when you're dealing with diabetic patients. So he said, how did these authors come to the opposite conclusion? Bullet point 1, they started with smaller amounts of L-Arginine, 3 grams, rather than the 5 grams thought to be the therapeutic amount. Bullet point 2, they reduced the 3 grams to lower amounts if the patients had side effects, which aren't clear what that meant, symptoms. They did not state who and how much. Third, the source of L-Arginine is from a company whose product I do not know. Here's the patient management curious notes, 3 more bullet points. The elasticity did not change on treatment. Why in the world did it not change if they were using therapeutic amounts of arginine? Next point, it says in the study that the diabetes was well controlled. And he says that's meaningless, because what does that really indicate? You know, what really were the A1C numbers showing? And then this one is the most curious. It says plasma L-Arginine barely changed on treatment. How little were they taking? So in other words, if they gave arginine and then did a blood draw, obviously arginine plasma levels would increase, and that wasn't happening. And so what is the deal? First of all, again, why weren't they using the 5 grams? But anyway, I'll go on to we'll sum this up. There's not a lot more to it, but he says, this is cardiologist research. If treatment does not change elasticity or vascular stiffness like it did for all your references, shouldn't you change treatment? They quoted 6 articles in the introduction saying L-Arginine improved vascular elasticity. So they cited the studies that showed arginine improved vascular elasticity. So then Dr. Joe asked the question, why not follow these articles protocol? Why were they doing something different, doing 3 grams when, as we know, the sicker an individual is, actually they need more arginine? Then he goes on to say, how long did the patients have diabetes? What were their other comorbid states? What were the A1C values? What treatments were used for those with diabetes? How well were they controlled during the study? Were the cardiologists attentive to the diabetes care? There are many questions that were unanswered in this study. In my opinion, this was an ill-conceived and ill-managed study. I maintain that the conclusions reached should be considered irrelevant since there are so many inadequacies in the study. And again, this is the one study that these guys will go to that shows this. So there's just all these problems with the study. I mean, Dr. Joe and what we were doing is a lot of times we'd go to even up to 20 grams of arginine if people were really having serious health complications, not giving them 3 grams to start with and then less if they're starting to have symptoms. I'm going on 20 years now of recommending arginine pathway nutraceuticals, and we just get so many glowing reports. The studies still confirm the benefits of arginine. So I would beware of this. Practitioners should have an open mind to what the other thousands and thousands of studies show with regards to the benefits to L-Arginine. Do it in the right amounts. Also take care of other morbidities that your patients may be having to make sure that they're on the right track in other ways, that they're getting healthier. So I appreciate that we had this opportunity to go over this. And again, Dr. Joe had 20 plus years with it. I had over 20 plus years with it. And there's just so many wonderful things. It's really helped so many people, as it did for Dr. Joe and many practitioners other than myself that have been using L-Arginine therapy within their practice.
It sounds like there's overwhelming evidence to use L-Arginine, a high quality tested product as well, like CardioGo from Bionox.
Appreciate that. Yes, thank you.
Thank you.